I'm Jay Asser, CEO Editor for HealthLeaders. Today I'm joined by James Hereford, CEO and President of Fairview Health Services. We're here today at the HealthLeaders CEO Exchange in Avon, Colorado. This is your first time being at one of our exchanges, James. How are you finding it so far?
It was good. I enjoyed it's engineered for a lot of interactions, and I think that's a really productive way to kind of conduct these kind of meetings. You get together with your peers and actually have real conversations.
It's the first time we're connecting in person, but of course we chatted about a year ago, I think it was, when I heard from you a little bit about what you have going on at Fairview. I know you, at the time, were telling me a lot about the financial turnaround the organization had, and a lot of that was through operational and workforce transformation efforts. So just interested how, in the past year, since we chatted, how have those efforts progressed, and what has been kind of at the forefront right now for Fairview?
Yeah, it's a great question, and it was a remarkable turnaround, like $600 million within a period of about 3 years. What it did is give us a platform. It didn't make all the problems in healthcare go away. It gave us a position where now we are able to take on a whole new set of challenges, right? So a lot of the investments we made from a operational perspective, operational excellence, et cetera, they have a cumulative effect. And so that's continued to pay off in terms of our results across the board. The fact that we did a $600 million turnaround, I think, is remarkable, but I thought more remarkable was our quality and service scores went up, our customer service scores went up, our employee engagement went up, and a lot of that comes back to, the kind of core operations. How do you get done the things you need to do every day to serve patients?
Is there one operational change in particular that maybe had a particularly big impact into the organization's financial performance of late?
Well, I mean, it's easy to point at labor because we're coming out of COVID and the hyperinflationary period that followed COVID, and contract labor was a huge part of the cost structure issue that we were having. And so that has largely been corrected, with the exception of a few hotspots, just really difficult to recruit kind of positions. Especially pharmacy played a big role for us in terms of really being able to leverage that. We're very good at it, good enough that, in fact, we've spun that company out and now sell it as a service into kind of like organizations of our size, right? But frankly, I wish I could say that there's some, silver bullet. There isn't. What we did was literally hundreds, maybe even thousands of operational improvements. And, I think the most important thing was we had invested, and I've been involved as a, operational leader for decades, around how do we build the kind of management system that can support continuous improvement. And we, stole liberally from a lot of the things that the Toyota management system did and Toyota did. That has paid, I think, immense dividends for us to be able to drive the level of improvement across all facets of our organization over that same time period. And that doesn't go away, right? You continue to build off that, and it gets better and better.
And you touched on, the first thing you touched on there was a contract labor and reducing dependence on that. Of course, the flip side of that is you have to ensure that your workforce is strong, and you're mitigating workforce shortage challenges. How are you going about building the workforce of the future right now? What are the biggest recruitment, retention, and maybe most important of all, education efforts that you're really focusing on right now?
Yeah, and I think that's the right emphasis because, part of the problem in Minnesota generally, Twin Cities specifically, is we're not a high growth market, right? We're not Nashville, we're not Dallas, we're not seeing double-digit population growth. We're very slow marginal growth, so you can't just depend on new people moving into the market and disproportionately grabbing those to be employees. So there is a little bit of a zero-sum game that goes on in the marketplace, and that we have to compete for the talent with a lot of other good healthcare organizations. And there's a finite amount of talent available. So we've done a number of things, but a lot of it, you stressed education, is getting way upstream. Having programs even in middle school, because I think healthcare I mean, we are a huge ecosystem, a huge industry. And it is one of the best for people to be able to move economically up into middle class. And so the ability to, start at a relatively, frontline, not the greatest paying job in the world, but a good paying job with benefits, but be able to progress that through education. But you have to get people there. And getting kids, all the way down to middle school, aware of the myriad of things you can do in healthcare. I mean, it's not just they see the TV shows and think, oh, well, that's healthcare, right? Yeah, no, it's not really that, because there's so many things you can do, and it's such a complex endeavor. Helping them understand that, to get them more oriented to at least think about a healthcare career, I think is really crucial. And then we do a lot of partnerships with educational entities across Minnesota, because we want to have the first chance. We want to be able to be the place where they do their practicums and their internships, and really appreciate the kind of organization we are, and then have a bias to coming to us. That I think has proved immensely helpful. A lot of credit to our Chief Academic Officer, Brad Benson, who really owns those relationships and collaborates across communities in a way that I think has proven very beneficial.
So another part of that idea about efficiency is, of course, reducing some of the unnecessary waste in your organization. Where are you finding meaningful opportunities to do that, and where are you maybe finding that it's not so easy to cut out the fat?
Yeah, in a complex system, we have 13 hospitals and 100 clinics and 36,000 people. A system like that always has plenty of opportunities for waste. And we found a lot of them, and that's part of why having an improvement system like a lean improvement system that really goes after waste, I think, is critical. One of my favorites, we ran a program and continue to run it, called Get Rid of Stupid Stuff. Now, they changed the last S, because when I took it from the University of Hawaii, did this, they called it shit, not stuff. But it's an opportunity for people to submit ideas, mostly around how Epic gets used. And Epic is our EMR. And it gets set in a certain way, it's built in a certain way, people train to a certain way. It's not always the most optimal way. And so we'd literally get hundreds of suggestions and implement, literally hundreds of changes. That got rid of a bunch of extra keystrokes and extra navigation that didn't need to be made. Also presented educational opportunities to say, well, it's there, you're just not using the tool well, let's sit down and do a side-by-side, and we can help you with that. That's a great example of that. I think on the people side, though, we're such a labor-intensive business. The temptation is always, if you have economic issues, you look at what levers you can pull, you start to say, okay, well, people, that's a huge expense. It is, but if you put people in a bad system and then you blame the people, that's not an equation for success. So we concentrate a lot more on the system. I do think there are places where we have probably, there isn't a lot more in terms of people, and I don't really put that in the waste category, but that's the danger, right, is you make too many cuts on the people side, and then you actually damage your ability to do the things you're there to do. And we're trying to be very careful about making sure that we don't make those kinds of changes.
I want to ask you also about this idea of systemness. I hear from a lot of CEOs, a lot of your peers, that especially at bigger systems, right, which continue to grow, continue to get bigger, aligning all those, the teams, the hospitals, everybody under one organization is a big theme right now.
Yeah.
What is something that's worked for you to create that alignment at Fairview?
Well, I think it's one of the things we talk a lot about, because I think as healthcare organizations and larger healthcare organizations, integrated systems have held great promise that we haven't necessarily delivered on, right? Too often the points of care work great, but the white space in between is where we fail. One of the classic lines I heard a long time ago was, we tell patients that, you will get a call from us on a referral, but if you don't hear from us, give us a call. It's like, no, don't put patients in that position where they have to own the complexity. And I don't think integrated systems have done a terribly great job of owning the complexity. So we talk a lot about that. And I don't think that's about centralization versus decentralization or employment home kind of issues. Are you all within the same corporate structure or not? I think in large part, we have great alignment with many large community groups. We have great alignment with our faculty in the component where we're delivering academic medicine. It is about having common purpose and having common ground, right, that you can stand on, and shared economic alignment. When one does well, everybody does well. It's one of the mistakes we made as healthcare organizations, is to believe that, boy, if we just employed the docs, everything would be perfect. We'd have great alignment. I would challenge anybody to point to a system where that's really worked the way that they thought it would. Because, that kind of employment model, I can tell people what to do, is a fiction. It's not true. It is more about how do you tap into what people care about. They came into healthcare for a reason, and whether they're external to our organization or employed in our organization or some other kind of quasi-relationship, it's more about finding what's that common ground that we all have and we're all oriented to, and making sure that we create, incentive systems where if the tide rises, it floats all boats higher.
So I want to zoom out a little bit and ask you a little bit about how to shift your mindset as a leader from these short-term responses to crisis to more of a long-term outlook where you're not just thinking about surviving today and tomorrow, but you're thinking about how you can be thriving and do it sustainably a year from now, 5 years from now, 10 years from now.
Yeah. Well, I do think that's one of the things that, as I talk to my organization, is we've now earned the right to pick up our head a little bit and look further down. When you're in the middle of a financial crisis, you got to deal with the crisis in front of you. And unfortunately, we're seeing more and more healthcare organizations, just because of the economics, move more towards that crisis mode. And it is incredibly challenging if you're in that phase to do anything that looks beyond the next quarter and next year. We're frankly fortunate in a position where we could sit down and have a 5-year plan, because I think that's where it starts is, okay, let's pick up our heads. Where do we want to be in 5 years? Where do we see these macro trends driving healthcare and driving our society? Because we're a huge part of that overall kind of the economics of healthcare. What are we, a $5.2 trillion industry right now? Projected to be like a $10 trillion industry by, I think, 34 or something I read this morning. So it's how we interact with the broader kind of ecosystem economically and in our communities is critical. But it starts with being able to pick your head up and say, okay, where do we want to be in 5 years? And then starting to organize around, okay, so what do we have to do? We are also fortunate in that we created a transformation office 3 years ago. And so Kathy LeBrew leads that, does a wonderful job, and it allows us to be able to kind of pick spots and have the discipline and reducing the execution risk to be able to drive specific transformational efforts in our organization and confront some of the things around how our clinical models work. Our clinical models, like most, are reflections of what's been happening over the past 30, 40 years. You go into a hospital, it doesn't work all that much differently than it did 40 years ago. So how do we think about those transformational models? You can't do that when the fire's licking at the bottoms of your feet. But once you get to that stable point, and many organizations are in markets where they're not at that same level of criticality, it's imperative that we start to look for that longer term, really think about what areas we're going to transform, how we're going to drive that. And then we'll always be looking for M&A opportunities that can be a part of it. I just think the non-contiguous kind of bigger sake, I'm not sure that's the right strategic move. Anybody who's pursuing that, good for them. We'll see at the end of the day. But what we're trying to do is get true systemness and the depth of our system. We think that's probably going to be the best guarantee against whatever threats come along in the future. But it really does start with, can you put that 5-year plan out there to say, okay, we're going to be here in 5 years. Now we start to back up. What's it going to take to get there? How do we get, one of our 5-year goals is to be, our net promoter score above 90. How are we going to do that? I have no idea. But I do know that the better we can satisfy our customers, the more loyal they're going to be. And they're not great judges of technical quality, even though we're really good technically. what they judge is how we make them feel. So the better we do of making them feel like we're there for them, we care, we're trustable, we're going to execute, we're going to own complexity for them, the better off we are. But we'll see.
Yeah. Well, I think that's probably a good place to end it. I know you've got to travel back to Minnesota. So, yeah, I just want to say thanks again for joining us at the Exchange, sitting down with me for this chat. Again, great to connect finally in person. Hopefully we can do it again soon.
I look forward to it.